Good afternoon, this is Rosalie Bouchard, and this is my presentation on health savings accounts. Health savings accounts allowed under Section 223 of the Internal Revenue Code are a savings account that is paired with a high-deductible health plan designed to put more control over healthcare costs in the hands of consumers. For 2015, an HSA-eligible high-deductible health plan has a maximum deductible of $1,300 for single coverage and $2,600 for family coverage. The out-of-pocket expenses, which include the deductible and copays, but not plan premiums, are $6,450 for single coverage and $12,900 for family coverage. The maximum annual HSA contribution for 2015 is $3,350 for single coverage and $6,650 for family coverage. These contribution limits include amounts paid by both the employer and the employee. When the Joint Committee on Taxation discussed the reasons for change to existing law when considering health savings accounts as part of the Medicare Prescription Drug Improvement and Modernization Act, they cited three goals. Number one, a mechanism to allow taxpayers to save up for medical expenses in a tax-favored manner. To slow the skyrocketing cost of health care, which was growing on average at 10.6% per year between 1999 and 2002. And three, making health care consumers more cost-conscious by giving them more control. Congress has taken on enactment and refinement of health savings account legislation over several sessions. Here's a preliminary list of the acts considered, which I will go into more detail about starting on the next slide. Health savings accounts first came into existence under the Medicare Prescription Drug Improvement and Modernization Act, which became law in December of 2003. Health savings accounts offer a triple tax advantage. The amounts put in the contributions are pre-taxed, the holdings are allowed to grow tax-free, and even the money pulled out, the withdrawals, are tax-free as well, provided that they're used to pay for qualified medical expenses. In regard to the pre-tax contributions, when the law first came into effect, the maximum was the lesser of $2,250 or the amount of the plan's annual deductible. And of course, the $2,250 would be indexed for inflation. At the same time the law came into existence, penalties were imposed for excess contributions at a rate of 6% and a 10% penalty for withdrawals for any purpose other than qualified medical expenses. Health savings accounts were further refined by the Tax Relief and Healthcare Act, which became law in December of 2006. A statutory limit was imposed at that time on health savings accounts contributions to $2,850 for 2007, which was to be indexed for inflation. In March of 2010, the Patient Protection and Affordable Care Act became law. Health insurance became mandatory for all citizens. Significant changes were made to health savings account legislation as well. Over-the-counter medications were no longer considered qualified medical expenses for HSA purposes. In addition, the penalty for withdrawing funds not to be used for qualified medical expenses went from 10% to 20%, plus inclusion in gross income. The 112th Congress took up two acts in regard to health savings accounts. One was called the Health Savings Account Improvement Act, and the other was the Restoring Access to Medication Act. Neither became law. The Health Savings Account Improvements Act was meant to encourage low-income taxpayers by offering them a saver's credit, which would be non-refundable, for deposits made into health savings accounts. The other item, the Restoring Access to Medication Act, was meant to restore over-the-counter medications as qualified medical expenses for HSA purposes. As you remember, this was taken off the table by the Patient Protection and Affordable Care Act. The 114th Congress considered the Health Savings Act, which did not yet become law. The act would have increased the annual contribution limits to deductible plus out-of-pocket expenses, significantly increasing the amount of money that can be put into one's health savings account. As I mentioned earlier, one of the key congressional goals for health savings account legislation was that there would be a vehicle to set aside money for medical costs in a tax-favored manner. There are approximately 17 million HSA accounts currently. the largest concentration of account holders are older, with higher income, and employees of large corporations. It's expected that this amount will grow considerably as we approach 2018 if the Cadillac tax of the Affordable Care Act becomes law, as this will impose a 40% excise tax on the amount in excess of certain limits. For example, any single employee health coverage in excess of $10,200, the amount above that limit will have a 40% excise tax attached to it. And the limit for families is $27,500, so anything above that threshold would be subject to the 40% excise tax. This will certainly make high deductible health plans and HSA plans more attractive to employers. This slide shows the average HSA deductions by age group. I obtained this information by gathering statistics off the 2013 individual income tax return information on the IRS website. As you can see, the dollar amount goes up with age, except for the last category for 65 and over, and the explanation for that would be that that group is no longer allowed to contribute to an HSA fund for the most part, unless they have not yet started to collect Social Security and or receive Medicare. This chart shows us the amount of HSA withdrawals by age group, which follows a somewhat similar pattern at least through the age of 55. And this slide actually shows you a combination of those two figures and how much would be the resulting amount left in one's account. So in other words, for each age group, I took the average deduction, the amount that was put into their fund, and the average distribution, the amount taken out to pay for qualified medical expenses, and the difference represents the amount that they were allowed to retain in their account. And that does follow the pattern of being higher with age. This chart shows the average HSA deduction per adjusted gross income group. And as you can see, the higher the income for the most part, the higher the deduction. This slide shows the average HSA distribution per adjusted gross income group for 2013. As with the contributions by age, I did the same for the amount of contributions by adjusted gross income. As with the average deduction and average distribution by age group, this chart shows the amount of average deduction and average distribution by adjusted gross income and the difference. And the difference would be the amount that the taxpayer was allowed to accumulate for tax year 2013. This chart classifies HSA qualified HDHB plans by the type of coverage. And as you can see, in the early years, individuals were opting for this type of plan more than employees of large groups. But that turned around and has never gone back. Large groups represent the largest number of new enrollees for 2007 through 2014. The second goal that the Joint Committee on Taxation had referenced was the slowing of health insurance rates, which had been rapidly increasing up until the time health savings account legislation was enacted. Since 2007, the rates have continually declined, down to 6.8% 2015 over 2014. The third congressional goal that had been cited was creating savvier consumers of medical care. The average account balance of health savings accounts is growing. There's approximately 13.8 million accounts with $24.2 billion in assets as of December 31st, 2014. The average balance at December 31st, 2013 was $1,408, and the average balance at December 31st, 2014 is $1,933, showing that people are indeed capable of spending less on health care coverage and retaining some of those funds. While health savings accounts are a good idea in terms of allowing someone to save up for medical expenses later in life, high deductible and out-of-pocket maximums are quite high, and in some cases are leading to people not going to the doctor when they should, which could ultimately result in more chronic illnesses. In addition, the migration of young and healthy from traditional plan risk pools, leaving those individuals behind, will lead to higher costs for traditional health coverage. As I mentioned earlier, there's legislation that has not yet become law, which Congress may reconsider. The first is the Health Savings Act, which would increase the contribution thresholds. The Restoring Access to Medication Act, to allow over-the-counter medications to once again be acceptable for health savings account withdrawals. And the last was Health Savings Account Improvements Act, which would allow for a saver's credit for low-income taxpayers. Okay. In order for HSA accounts to be more widely used and beneficial to others than the very high-income individuals in the country, it's critical that proper education be given to people so they know what options are available. Young people of low income should be made aware that employer contributions may be available to them and that they can pay into their own fund on a pre-tax basis. In addition, older individuals need to be made aware that if they register for Medicare and/or Social Security, they will end their HSA eligibility. If they don't wish to do that, and they can hold off on registering for those items. Congress may also decide to implement some other types of legislation to encourage things such as funding a family member's account or creating a 529 type plan for young children. I know up in Maine there is a program for anyone that opens a 529 account for a newborn that a $500 grant is put into that child's account to get that ball rolling. In addition, they may decide to have automatic enrollment, as there is with 401ks. Of course, there would need to be safe harbor provisions to prevent anyone getting in trouble who technically is not allowed to own an HSA account. This concludes my discussion of health savings accounts. Thank you very much.